Patients often view the actual physical examination with concern. They feel vulnerable, physically exposed, apprehensive about possible pain, and uneasy about what the clinician may find. At the same time, they appreciate the clinician's concern about their problems, and they respond to your attentiveness. The skillful clinician is thorough without wasting time, and systematic without being inflexible. During inspection, palpation, auscultation, and percussion, examine each region of the body, but remain sensitive to the whole patient, noting each wince or worried glance, and sharing information that calms, explains, and reassures. Tell the patient when you are moving from one segment of the examination to the next. Throughout the examination, be gentle, but don't be afraid to cause discomfort when it's warranted. Earlier, I spoke about the importance of courtesy. During the examination, you demonstrate this in many ways. For example, simply by washing your hands in the presence of the patient, you show respect right from the start, which helps set the tone for the remainder of the examination. When examining the abdomen, warm hands and a warm stethoscope are minor but significant reassurances of your intention to do no harm. Likewise, avoid long fingernails and offensive colognes or perfumes, and always remember to observe the patient's face closely for signs of discomfort. Your approach to the patient should also minimize the number of times you ask the patient to change positions. This not only saves the patient from an inconvenience, it also reassures the patient that you are a trained, decisive professional. You send the same message of courtesy and authority when you are clear and unambiguous in your directions or explanations. If you leave the room, make sure your patients know if they are to wait or whether they are to get dressed and return to the waiting room. Few requirements of the examination distress patients more than the need for them to disrobe or change into a revealing gown. That's why attention to proper draping technique is so critical to your relationship with your patients. By demonstrating that you respect the patient's privacy and personal space, you instill confidence and promote collaboration. Draping technique differs slightly between male and female patients. However, with either sex, you'll want to develop a routine that's in sync with your sequence of examination. It's essential that effective draping and consideration in how you adjust the patient's gown become second nature. Throughout the examination, try to remain aware of the patient's feelings and extend this empathy to other privacy issues as well. Assert control over room access during the examination to prevent casual or unwarranted intrusions that might cause the patient distress. Even a seemingly minor intrusion or some other momentary loss of privacy can shut down all cooperation by the patient, with lasting ramifications to the relationship. Rectal and genital examinations are best performed at the end of the head-to-toe examination for this very reason. The examination and the associated questions are often perceived as intrusive, and patients subsequently become anxious to complete the examination, get dressed, and depart. As a professional, you owe it to yourself, your organization, and most importantly, your patients, to observe your facility's policies on issues such as third-party attendance during sensitive examinations and confidentiality of records, to name just two of the many issues with serious legal ramifications. Over time, the laws and regulations that serve both you and the patient tend to evolve, and a key ingredient in your approach to your patient is to always be aware of and adhere to the rules that govern our profession. By serving them, you better serve your patients. Few clinical techniques are as critical to a successful relationship as how you handle the discovery of positive findings. As a beginning clinician, be judicious whenever you consider sharing findings with the patient. After all, you are not the patient's primary caregiver, and your views may be conflicting or in error. As you grow in experience and responsibility, sharing findings will become more appropriate. If the patient has specific concerns, you may even provide reassurance as you finish examining the relevant area. Be selective, however. If you find an unexpected abnormality, you may wish you had kept a judicious silence. And if you discover abnormalities such as an ominous mass or a deep oozing ulcer, avoid showing distaste, alarm, or other negative reactions. Whether you find an abnormality or not, there will be occasions when you will spend an unusual amount of time on one area of the examination, enough time so that the patient might become alarmed. At such times, a few words of reassurance may be all it takes to set the patient's mind at ease. Finally, remember that your relationship with the patient will be ongoing. Reassure the patient that you are committed to continuing care and that you will follow up on any concerns. It's sometimes easy to forget that patients have a life beyond the examination room. Their own medical care, no matter how critical it may be, is not always their first priority. They look to us as healthcare professionals for leadership and understanding. At the same time, we can forgive our patients if sometimes they believe that their own particular case should occupy our every waking moment. So in your approach to the patient, try never to forget that each and every patient is unique and important, deserving of all our respect as well as all our skill.